So welcome everybody to Life After Spreadsheets, Data and the Future of Response Logistics, which is probably maybe not the sexiest thing you could be doing this afternoon, but hopefully it'll be a useful thing that we can talk about today. Couple housekeeping items before I toss it over to Drew to kick us off properly. We are recording this, so just want to make everybody aware that this webinar is being recorded. As Drew mentioned, we are using the chat today for soliciting questions, comments, feedback. So please use that. We have mics and cameras muted so that it saves bandwidth and we don't have any feedback and reverb and things like that. Additionally, want to thank everybody who submitted questions to this webinar, and especially everybody we've talked to over the last 2.5 years of putting this together. A lot of really incredible feedback, a lot of really familiar faces to popping in here. And I just want to thank everybody for giving that feedback, giving that time. Hopefully you'll see your comments reflected in the demo part of today and see the how that's shaped up over time. I think that pretty much covers it. Drew, anything else, or do you want to kind of kick us off?
No, just remind you, if you have questions, put them in that chat box. We'll try to answer some as we go, but we'll collect them. If we don't get it at the end, we can follow up with you.
All right.
So kind of let folks know what we'll do today. First half hour, we'll spend the points 1 and 2 there. I want to talk about kind of what we've done the last 2.5 years, talking to folks, doing survey, understanding what the landscape of disaster logistics is right now. What does that look like at the individual level, at the local and state level? And then next, want to talk about what that path forward and how we can optimize that. Some best practices, some of that's about logistic management software, the LMS, some of that's outside of that and processes, but hopefully there's some nuggets in there that you can pull out and maybe apply to help optimize your operations. And then lastly, we kind of want to do a sneak peek of our LMS that we've built, taking some of those, path forward lessons that we'll talk about and baking them in there so it's kind of built in to work that way. So that's what it kind of looks like there. And we'll save 15 minutes at the top of the hour then to go over any questions we have and we can answer there. So let's start at the highest point. Everybody in here, I'm going to share something that's not groundbreaking to you, but disasters are increasing in frequency, right? They're increasing in intensity. Geographic area they're hitting is more and more. And us as agencies or have people have a hand in that response, that recovery, the public demand for that is getting more and more. We have to be more dialed in. But what we've found is once a disaster becomes dynamic, once it becomes ongoing, we don't have a great clarity on what we have, where it is, and how much we have. And, in my experience, 90% of a mission success is allocating those resources on time to where they need to go. So, that's never part of our research that we'll share last 2.5 years is that's not our fault. We haven't been kind of given the tools to do that job. We've been asked to do it with spreadsheets, commercially available tracking systems. It'd be like giving our comms folks tell to go do mass notification, but not letting them use Everbridge or any other platform that they use. And it's kind of, a wild, and some of this stuff is going to be pretty predictable, but it's kind of shocking to kind of the state of what we're asked to do. Next slide, Eache. So, why are we getting into this? Ethan, my brother there, and Steve, our other partner who's answering questions here. I wanted to get back to kind of May 2020, where were you guys, everyone working here, had a hand in COVID. Ethan and I were helping a large state agency in their response during doing an alternate care site, a field hospital. And eventually, we got really kind of fed up and not having the stuff and things we needed on time. How are we supposed to protect our medical personnel and serve those patients when we aren't getting the PPE and all the stuff that we need in a predictable, nonetheless, just this bare minimum of what we need for the next 24-hour operational period. So we took a step back, looked at the larger logistics picture. And what we found was it wasn't a lack of trying to track things or a lack of effort. Once you have a dynamic situation and outside of that main warehouse, people were using homebrewed systems. So people were creating their own spreadsheet at each kind of different field site, trying to feed that back in without success. So we didn't have predictability. Ultimately, we didn't have the stuff we needed as efficient as we needed it to be. Next slide. So we spent the kind of last 2.5 years talking to folks and researching, taking a step back and really gaining other people's perspectives as well. So this looked like anywhere from 30-minute convos to 3-hour conversations with emergency management coordinators, public health agency log chiefs, agency directors. And, I was overwhelmed by the gratitude that people really open it up and say, hey, this is what went well. This is what didn't go well. This is where I really like to have support and see the industry move forward. And this is where, it worked and we need to build that more. So what we found was, we'll dive into this next, but overall kind of a overarching theme is existing software systems were never made for disaster situations. So spreadsheets are great, but spreadsheets were never made to track, consumables, access, put them out to different sites, feed it back in. Commercially available systems, ones that we've been forced to use to adapt, our conclusions after researching that was, that'd be like asking Foot Locker, instead of doing their operations, and that's the software they're using, is, hey, you have 12 pop-up shops starting tomorrow. You have a push pack coming, you don't know when, and you have to train employees in 20 minutes to use that system. So that's the system we're using in that environment and trying to make it work. And then there's some custom built software that, some agencies use, which has some effect, but ultimately it becomes way too bogged down because it's too much info and they're too hard to train on. Normally doesn't get updates because it's custom made. So let's dive into that. I want to share some of these survey results that we had in the conversation. So right now from the agencies we talked to, which is primarily local, public health, EMAs, disaster response organizations, and state agencies, 53% of people were on spreadsheets, 33% of people were using a commercial available software, things like Sortly, Asset Panda, and 14% of folks use custom software. Pricing, anywhere from $2,500 to $250,000 for those custom builds. To note that $2,500, a lot of that, goes back to that about 50% of people using spreadsheets, so that kind of built-in cost there. So what are people tracking with their LMS? So what's this saying? Really high adherence rates. We're tracking stuff. About 95% of people have something in place, right? That's not shocking. There's, guidance if we want certain federal funding to track stuff. So that can be spreadsheets, 213 RRs, anything, but we have something in place to track stuff. What does this say? What do people wish their LMS tracked better? So people have a system in place, but it's not necessarily designed for their specific needs. So there's a gap between we have something, but we want maybe something different that it's doing. Next slide, E. Where can people use their LMS? So the main warehouse is definitely covered. That's where they're having it on blue sky days, not too worried about that. But if you look over to the right there on the side of that chart, once it leaves the warehouse, that's where people really needed support. Once it's a dynamic situation and you're pushing stuff out, that's where people really want to use, are unable to currently use their LMS. What do people want their LMS to use? And then again, look at that far right. So again, warehouse pretty well covered on blue sky days. Once it leaves, alternate care sites, those point of dispensing for the public health people, that's where it really needed support. And then that, from our research, goes back and messes up that warehouse. So on a blue sky day, a spreadsheet might actually work if you're tracking it in there. But once you have a situation and you're having a response and opening up, that's not being tracked well. That feeds back and messes up your warehouse, especially as you have different resources coming into that warehouse and pushing them out. It really gets messed up there then. Next slide, E. So lot and expiration, talk about that real briefly. Most agencies are not tracking lot and expiration on all items. What this tells us is about a quarter, about 25% are tracking for vaccines and medications only. 23% about people are tracking it for all consumables. So if we can really track that lot and expiration on what needs to be tracked, lot and expiration, and how, we can make it as simple to use as possible. Because, the EMA folks, the public health folks, after what you went through with COVID, we spent a lot of time trying to crack that and say, how can we track the lot and expiration? How can we integrate cold chain into this and still make it usable so it doesn't break and, it doesn't take one power user to have to operate it. Next slide. E. Some of the other findings we found. I've encountered inaccurate data in the system in the last 30 days. 71% of people agreed with that. Spreadsheets is a big culprit of this. People even who said, no, mine's accurate. We actually asked a few people, say, oh, it's 100%. Can we take a look at it to see how you're doing it? In all those circumstances, we found inaccurate data in the first 10 minutes. So it's not their fault. Again, Spreadsheets was never meant to do something that heavy and that dynamic. So inaccurate data is a constant uphill battle right now. Someone can be trained on the system just in time. About 25% agreed to that. I think the key takeaway of that is the question in the survey, and when we talk to people, is they think it can be trained in that. And, I'm not above this, over self-confidence sometimes. And, I'm familiar with the system, so somebody else can too. It's in actuality, as we've deployed and everybody here has done just-in-time training, it's probably a little bit lower than that. 10% of people said the system has useful insights, visualizations, or predictive modeling. Not mind-blowing, but kind of insane as an industry, what we're asked to do, right? Think back to COVID and having to predict what you need a week out, 2 weeks out with these populations, and we don't have systems that are helping us do that. We're collecting some of that data. How's it not predicting it? So my LMS can project future needs based on past Eaches, 5%, kind of tied back to that last one. Should be an easy lift for us. The system makes reimbursement easier after the response. Boy, anybody who's gone through the FEMA reimbursement process and nationally declared disaster, that's a headache, 14%. If we're tracking this stuff accurately, we should have a disaster-based system that can feed it into something to help that case that you're doing to FEMA. Anybody's worked with that, you're presenting a case to that case manager. This can be a huge one with accountability. Who used it, where, and for what response, and what funding it came from. This should all be stuff that is built for us, in my opinion. I'm confident the system will be able to handle the next big one when it comes, 14%. And this is what really motivated Ethan, Steve, and I. I understand we're in so much pressure and in such a fast environment to move on to the next disaster, and we don't have time to always integrate lessons learned. But we just went through an enormous effort, and it pains me to see that if we have to make some of those same mistakes, and we haven't built them into systems that support us. And that's where a lot of our energy is gone. I've often thought there's a better way of doing this. 90% of people agreed to that. So, thing I really want to drive home is we got to understand where we are as an industry, why we're here. We're using spreadsheets the best we can because that's the tool we're often given. The commercial things like Sortly, Asset Panda are great for commercial use, but for our research, it just doesn't match the environment and the things we're asked to do. And it's failed us to this point once it becomes one of those dynamics situations. So in short, it's not meeting the need across the board. And we wanted to say, okay, so how can we optimize this moving forward? So I'll turn it over to you, kind of expand on that maybe.
Yeah. And so all of this was kind of, we were kind of searching for what is the ideal LMS if it was built for disasters. If we built ground up and said, hey, what do we actually need as responders rather than, beg, borrowing, and stealing from everything else and making, everything on our own on spreadsheets? What does that look like? And that data was really helpful for at least identifying where we're at as a baseline. The other thing we took a look at was some problems that we identified that are small tweaks, but fundamental to disaster logistics management systems versus other stuff that's out there. So The first thing is how we count. All the commercial systems that are out there that we adopt and we bring into our industry and say, let's make this work, they're retail systems for the most part. They're built on a package SKU. So think of like a 10 pack of pens that's sold as one unit. They're not really worried about how many individual items are in there. That package, that blister pack is a count of one. But what we're really interested in for us is how many individual things are in there. Because when it comes to scarce resources, you may have to split some of that up, right? Getting a total count that you can bring and aggregate to a category level is really important. Having a more granular burn rate is going to help you project what's being used. Talking by package, talking by product is going to separate your data. It's going to disaggregate it. It's going to chop it up to the point where you're going to have a bunch of line items for every type of pen, even if they're all black pens, and you can't get a total number from that. So the first thing that we kind of identified and put into practice in a very, very early system that we pushed out was counting by Eaches. And I'm going to be the first to admit, I was dead set against it when I first heard this concept. And it wasn't until I was very much proven wrong on why this is so useful that it made a difference. And I'll give one example that's really good. For those of you who may have at different points filled out a 213R and for quantity you put 10, you put gloves, you put 10, medium, nitrile, exam gloves. And if something ever showed up that was either 10 gloves in a plastic baggie, which is definitely not what you wanted, then you definitely know what this pain. Or if you got 10 like crates of gloves, the unit of measure matters. If you have one fundamental thing across the response, then you always know what you're measuring by. So that is one of the more fundamental areas to pivot where you can make a lot of improvements, even if you're on spreadsheets. This leads us to the second issue, which is categories. So I kind of alluded to this a little bit already. If you've got a whole bunch of things that are technically really the same, but they're different products, that's going to put those on all different line items. And you have no way to really say, how many widgets do we have? How many medium exam gloves do we have? Not how many different products. And then for each product, what do you have? We need to kind of be thinking more about that category level. And for anybody familiar with resource typing, that's why it's there. We all know it's there. It's just annoying to use, right? Because it's not familiar to what we call things. We use product names. We say Kleenex. We use colloquialisms. We do a whole lot of stuff, and we don't really say, oh, hand me that gloves, exam, nitrile, medium. Nobody speaks that way. But it's a shift that is really important on the data side. If you can get everything to aggregate up, then you know 100% how many items you have in that category at any time. You don't need to go and head up everything across the board. Commercial systems don't do this, and that's why it's something unique to where and how we live in this space. Third problem is everything tends to be warehouse focused. And that makes a lot of sense. For commercial systems, they are based on warehouses. They're pushing a lot of stuff out to stores. They only need to know what to push every once in a while. But that's not what a response looks like. This is much more of what a response looks like. There's a lot of different things out there. You got pods, you got caches, you got hospitals, you got field sites, you got all sorts of things that you're tracking burn rates on. The other thing is, if you don't have data coming in from the field, how do you know what to push out? We're very much pushing things without any data to base those decisions on. And we need to move past that. We need to figure out a way to organize the data so that we know at any point what we have and what we need to push based on usage, getting much more grounded on the field level and saying, this is the need in the field. How do we get this to them? And like I mentioned, the problem with other systems is they tend to be location-based. So physical warehouses, that's not super useful for our world. We're response-based. We're not location-based. So your data, and Drew has mentioned this earlier with reimbursement. The reason why reimbursement gets so hard is because there's nothing to aggregate all that data by the response. If you can organize everything at the top level by a response, everything gets used, all the labor, all the consumables, all the assets is wrapped in the response, then you can just pull up that response name and everything associated with it. Instead, we tend to be, and other systems, they'll be focused on a location like a warehouse. That warehouse supports tons and tons of different stuff. So that would be like that third problem we sort of looked at and said, hey, that if we are making a logistics management solution for disasters, this is kind of the three things that we need to be focusing on and fundamentally changing. So when it comes to then impact, right? How do we know any of this works? Why does this matter? If we make those changes, how do we know the juice is worth the squeeze and the effort that goes into that? Well, we fortunately developed a lo-fi version of Logista early on and used it for the state's COVID-19 medical surge. Now, this wasn't a full-fledged system. There were a lot of flaws with it. I will be the first to admit it. But we did make those three changes. And this was the impact. So operationally, it saved about $800,000 per quarter. So a total of about $1.6 million for when it was being used. Fulfillment rates for that response went from 33% to 88%. So those 213 RRs, they're being filled at about a 33% fulfillment rate prior to those changes. We made those three changes in a system that we put across the entire response, and that jumped immediately to 88%. Inventory accuracy also impacted. 28% is what we were looking at before for spot checks. That jumped to 98%. And the most amazing fact about all of this was there wasn't a single additional purchase order placed while we were implementing that system. So those numbers, those efficiencies all happened because of just knowing what we had on hand, knowing where it was, and being able to anticipate the needs. So nothing else was purchased in order to improve all of that. In terms of savings, labor in the field, what was taking people about 4 to 6 hours per day in the field dropped to about 25 to 45 minutes. So an 88% savings in time. And then in shipping, we were sending 9 trucks. I'm sure a lot of people experienced this as well. A lot of emergency requests. So last minute, everybody's going home, and then it's like, we need gloves, we need gowns, we need this or that because we just did the count today, or we didn't do the count, and we went to grab something, it was an empty box. So please, can you send us it? We were spending so much money and time on last minute resupplies that we were sending 9 trucks per week. We cut that down to 1 truck per week, and that's about an 87% reduction in costs. So those are some dramatic impacts for just changing those 3 pieces. So kind of coming back to what Drew had kind of mentioned earlier, where people are at, what they're using. I think we all kind of know where spreadsheets work and where they don't work. And they're easy to break. There's not a lot of data integrity with them. And most of the time it's relying on one power user. And we there are moments for spreadsheets, and we'll highlight where we think those fit. But in terms of a full system, they're really, really finicky. And if we are planning for the next big one, and if we're saying, hey, what should we have as an industry? What do we want as a group? I don't think it's that. Commercial software, because of the limitations of how you put data in and how you take data out, it's like a suit that just doesn't fit. Technically, you're covered. Nobody's gonna give you a ticket for walking around naked, but it's never gonna be exactly what you need. The other part is most of these companies are repurposing old architecture. So it's a system they already have. You look at Salesforce, you look at some of these other folks, they already built a commercial system. They are not motivated to actually do what they need to help you out in the disaster world. Though sales folks will promise everything, but when it comes down to it, they're going to try to tweak whatever they currently have on their tables on the back end and just make it work because there's not enough financial benefit for them to build from scratch. So it's old architecture that's going to have problems if you inherit it. Last part is custom software. Custom software can be great if you have the money and if you have the time. The tricky thing I've seen with that is it can be a bit like the commercial software where folks, you spend a lot, you get part of what you want, and then from there on out, you have to keep paying to get updates. So security risks are there. They can be really complex to use because they're building a one-off for you. So they're leveraging prior systems that they maybe built. It tends to be a very arduous process for folks. More importantly, all these things are reactive. None of them are predicting data for you. They're not operationalizing the data. And what we need for an industry is to say, how do we get to where we want to be better? Not just, is there something to document, but how do we start making it useful for us?
So we're thinking, how do we move forward? And we can blast through this part, because I want to drive home the point real clearly. We can't do everything, or else the system just becomes too heavy and there's too many individual needs. But we can hit a lot of those. And what we identified through everybody's help and conversations and surveys, we asked people to choose what's the single most important feature you want in your disaster LMS. And what people said, they wanted to be simple to use, wanted to be built for disasters, and they want to have real-time data. So it provides accurate data and they can make it predictive. So this quickly becomes, on our side of what's nice to have and what do you need. So one of the lenses we put on is the Pareto principle, right? And anybody who knows me knows I just preach this in every part of my life, but 80% of consequences come from 20% of the causes. So, you think of your projects, 20% of those have 80% of the impact on your mission, your outcome. So how can we apply this to our LMS as we developed it and support people? Well, if we can identify, again, those 80% needs, and it's 20% of your effort to get that what it looks like is a disaster LMS, and then it's always going to have some other processes to it. Like Ethan mentioned, some spreadsheets that may support that. So that's what we really did, is say, how do we hit the biggest pain points for people through this LMS?
And kind of springboarding off of what Drew was saying there, there's always going to be that middle standardization of what everybody does. And if you can hit that very, very well, very, very simply, you're going to do pretty well during a response. There's going to always be a lot of hyper-local, hyper-specific needs. How you guys process things like generator hours, documentation, or other maybe some specific assets that are unique to you. Those other systems that are layered on generally are not the bulk of the work during a response and are the perfect examples for spreadsheets that you use in addition. Or we had a question about things like Power BI, low-no code solutions, things like Google Apps Sheet. Those could also be a solution. They can be a lot of work to implement, but that's something that you layer on top for something very specific. So kind of transitioning from the overview and kind of what we see as the problem and some of the data information, this is where we get over to the other half of today's program, which is a sneak peek. Again, please, if you have comments or questions, drop those into the chat. We'll hit those at the end. We want to make sure that we don't lose any of those questions and good comments, just because we're going to take a little bit of a segue here. So we spent the last 2.5 years revamping what that lo-fi MVP was and figuring out what that looks like for the future. And we set up some pretty lofty goals for ourselves. The first is that it must be deployable in 10 minutes. If you already have it installed and a disaster comes, you must be able to stand up all your logistics needs in 10 minutes. It should only take 5 minutes to deploy. You should be able to train anybody in the field, any of your volunteers that are moving product, distributing product in about 5 minutes. And then the final lofty goal we set for ourselves was it should only take 1 minute to find any piece of data. During COVID, it would sometimes take us days to recount everything to get the data that was being asked by command. So we really wanted to streamline that and make it a lot faster. So I've been talking way too much. Drew's been talking way too much. I've seen a couple of comments pop in here. Steve, is there anything in particular that you've seen that you want to highlight?
I got a couple.
Go ahead.
I guess that were sent to me via LinkedIn and email ahead of time. Someone asked if we could present to their local regional MCM group, medical countermeasure group. Yeah, we're happy to jump on calls if you have a quarterly, monthly, whatever group, whether that's a regional group for disaster planning or a public health medical countermeasure group, we can definitely jump on that and share what we've learned this, or, you know, any info that you want to pull to those groups. Happy to do that. That was probably a couple other ones that emailed me to me, but I'm going to respond to them individually, but that was one I wanted to share with people.
One of the ones that came with the registrations was asking how they could use money from FEMA during the Category Z section of reimbursement. And to be honest, I'm not a reimbursement specialist. I had to look this up, but I believe that's in reference to indirect and direct administrative costs and anything that goes into managing a declaration or the administrative costs related to managing those projects. So my understanding, and if there's anybody who is an expert on the call and want to chime in the chat, please do. But my understanding is the cost of Logista would be covered in that because of the efficiencies gained, both during the response and even in the reimbursement part of compiling all that information. Another one that came in with registration was asking about the difference between a longer-term response and a shorter-term acute response. So something like COVID versus something like a terrorist attack or an earthquake. I think at a very, very high level, the long-term data collection and analysis for a COVID response is something that can be leveraged in this. So if you use that date range, you can look at winter peaks, you know, isolate that data and say, all right, we're going into another winter. Let's look at last winter and see what we used and what we need. As far as something like a terrorist attack, an anthrax attack, it's much more about standing up those pods and moving people through it, knowing what you have at the end of day one and saying, okay, are we good for day two? Yeah, we are. Or no, we need to shift some stuff one way or another. So those were a couple of the ones that popped in there.
Yeah, Ian, just to reiterate to some folks here, I know you're representing other people, or it's a group of people to make decisions to move things forward. So we'll send out the recording of this to the folks who registered for this, so you can share that along. Also, you'll have our emails, you have our phone numbers, so certainly reach out if we can follow up more info or more relevant info to your group.
Drew's point, we'll send an email. It's going to have that case study that we mentioned earlier, so you'll be able to get that. A couple other plugs. We've been building some free tools for folks. There's stuff that maybe isn't going to be in this first version of the LMS, but there's stuff that we still want to help with. So things like a volunteer management and donation plan template that's on the website, an AAR improvement plan with a dashboard. As long as you've got a Google account, you can download these. These are for you. They're free. It's just stuff that we make because we just kind of want to be useful and helpful. So definitely pop on there. And a plug for if you are curious about some of that AI stuff and wondering what direction it's going in, next week we do have another one of these webinars, the Preparedness Partners webinar with Justin Snare. He's a managing partner at Signal Solutions. He's going to break down a lot of the stuff around it, because I know a lot of folks are interested, but there's a lot of, you don't know what you don't know. And he does a really good job of explaining some of that stuff.
That's all I had for Ryan. I appreciate everybody jumping on, checking it out. Definitely get in touch if anything we can do for your regional groups and that kind of stuff. Otherwise, we'll be sending it out, and we'll see you next week. If you're able to jump on Justin's conversation, it should be pretty fun with the AI stuff.